Simulation training in various industries is a proven means of reenacting stressful or potentially dangerous events for the purpose of safely and effectively learning to manage the situation. Most of us are likely familiar with the use of flight simulators in aviation and aerospace training. Today, healthcare simulation is continuing to grow in sophistication and effectiveness. Ridgewater College is leading the charge toward new and innovative uses for simulation-based education. 5 years ago, Ridgewater College and our partners came together to address some serious challenges to quality healthcare in the region. One such obstacle to quality care has been proper management of adverse healthcare events. Many potentially serious incidents are not common in practice, so simulation experience can be vital to identification, intervention, and prevention. Another challenge faced by rural healthcare providers is a shortage of qualified nurses. Simulation is helping to overcome this problem by improving recruitment and retention of new nursing students, as well as providing professional advancement and training opportunities not otherwise available to practicing nurses. Ridgewater, along with community partners, came together in response to these and other challenges. The result of this collaboration was the Ridgewater College Nursing Simulation Centers. Simulation-based training is having a dramatic impact on students.
I think simulation training really fits in 2 ways. I think it's, obviously it's very high-tech, and so I think it makes the training itself very interesting for students. It's more than just sitting in a classroom reading from a book or listening to a professor. It's hands-on, and so we're dealing with much more critically ill patients, and the simulation training really allows us to put our nurses' skill levels to the test and to hone those skill levels while they're still in the workforce.
While we have done much to ensure quality healthcare in rural Minnesota, challenges still lie ahead for the region. Issues of concern include limited clinical opportunities for new nursing students, limitations of rural healthcare providers to access training in specialty areas such as pediatrics, patient safety, lifelike training for emergency services personnel, and more. Once again, Ridgewater and our partners are poised to provide solutions to these challenges.
Just take a simulation model and put it in a bed and say we're going to be a good program is really folly. You have to have a tremendous support staff, which I knew they have at Ridgewater College, to help give folks the knowledge, the didactics, the teamwork skills to be able to succeed in a real-life scenario. Simulation takes it to the next level by having a real case scenario, real-time, real equipment. Then you really make it a powerful learning event.
Our experience with simulation-based training has made it clear that a mobile simulation center is a key to addressing these new obstacles. It is our goal to once again partner with you, the leaders in our communities, and healthcare institutions across the state in developing this solution. A mobile simulation center would expand upon the success of simulation in healthcare education by delivering training with accredited coursework virtually anywhere in the region, enhancing patient safety through multiple learning environments, creating multiple scenarios, and by providing a flexible and scalable training experience to both students and practitioners.
The beauty, in my mind, of mobile simulation is that it will provide state-of-the-art training in everything from how we respond to bioterrorism to training for EMTs, first responders, doctors, nurses, really the whole gamut of healthcare professionals out there. It will be state-of-the-art training that they couldn't get otherwise because we can't afford to provide it to, every clinic, every hospital, etc. And in rural Minnesota, what's important about that is that we don't see enough of some of these medical crises in order to really be able to practice them and get any good at, essentially saving lives.
The Mobile Simulation Center will be a converted recreational vehicle, similar to the one seen in this video. It will be capable of delivering training anywhere it can travel. Inside the center will be a private control room, a mock emergency room, an ambulance bay, training equipment including SimMan and SimBaby, communications equipment to share and archive the training, and much more. This mobile training center will be a reflection of the commitment we have towards creating a world-class healthcare system in Minnesota. Simulation-based training in healthcare is proving its effectiveness on a daily basis. Due to time and expense, many healthcare providers are not able to house their own simulation labs. A mobile simulation center will enable literally anyone involved in healthcare to access this potentially life-saving equipment. The vision of a mobile center will focus our energies through enhanced learning, flexible training, and better performance across the entire region. The healthcare landscape is changing rapidly. Together, we can provide a measured response to meet these new challenges. Healthcare facilities and personnel locally, statewide, and regionally will benefit from our vision, commitment, and leadership. Air travel has become one of the safest and most effective means of transportation, due in large part to the benefits of simulation training. We and our partners are helping to address many challenges facing the healthcare industry with similar technology through the creation of the simulation centers at Ridgewater College. Now we are poised to take the next step in healthcare education by building a mobile center able to provide the benefits of simulation-based training to anyone, anywhere, anytime.